Hi again, I'm Lennox Hoyt, MD, fellowship-trained, board-certified urogynecologist, and we're here to talk a little bit about fistulas. Fistulas, as we talked earlier in a previous video, are abnormal connections between like the bladder, for example, and the vagina, or sometimes the rectum and the vagina. Generally speaking, a fistula is an abnormal connection between any two organs. Today, the question becomes, is fistula life-threatening? And what I'd like to really point out is fistula is really two different diseases. There are fistulas that happen related to surgery, usually pelvic surgery, that are more common or prevalent in developed countries. They usually are repaired surgically, and they can be repaired promptly, usually within a few weeks to a few months of the injury being discovered. The other kind of fistula, even though it's still an abnormal connection between usually the bladder and the vagina, they're obstetric fistulas. They happen as a result of complex, prolonged, arrested childbirth. They mostly occur in less developed countries. And when they do occur, they're really difficult to repair. And in fact, there are specialized hospitals around the world, usually in less developed countries, that are dedicated towards the repair of complex obstetrical fistulas. Fistulas, as a general matter, are pretty much beyond being a nuisance. They dramatically affect quality of life. They affect hygiene. They're difficult to keep clean. They smell bad. It's really life-changing. So many women would change their habits and their lifestyle to accommodate the fact that they have a fistula. They generally are not life-threatening. Fistulas can lead to infections in the bladder, reproductive system, and in those cases, when those infections occur, they need to be treated. But as a general matter, fistulas are terrible, but they tend not to be life-threatening.